Doctors found what growing inside his nose. Doctors offered to find what had been growing inside his nose for the past few months. A 38-year-old man in New York had breathing problems. He was having trouble breathing through his right nostril, and that was causing him insomnia. He decided to take it to Dr. Khanna at the Cleveland Clinic. The man said he had had a problem for years, but it had become severe. In the past few months, doctors thought it was a deviated septum. In simple terms, the cartilage responsible for separating the nostrils loses its shape due to some injuries or genetic reasons. Doctors referred some normal tests to the man and thought it was just a normal case. While the doctors were performing a rhinoscopy, they found something that shocked them. Rhinoscopy is a way to see inside a person's nostril, and during the operation, doctors found a hard, white mass inside the man's nostril. This was clearly not a case of a deviated septum, as there was a foreign substance causing the man's breathing problems. Dr. Khanna asked the men to have a CT scan immediately. Reports revealed a tooth growing inside the man's nose. Yes. You heard me right. There was a 14 millimeters long tooth inside the man's nose. No wonder he got into trouble. Respiratory doctors claimed they had never seen anything like this before, and even Dr. Khanna was shocked. He diagnosed the men with an inverted ectopic tooth, meaning it wasn't just the tooth in the wrong place. It was actually growing in the wrong direction. The man's teeth were growing upward towards the skull instead of into his mouth, which caused many problems. The patient was also in shock. He couldn't fathom what was going on, but Dr. Khanna and his colleague Dr. Michael Turner made sure there were cures for his condition as well, which of course included a small operation in which a special visitor was inserted precisely into the man's nose. I took out. This was done by an ENT surgeon. After a series of delicate surgeries, the doctors were able to remove a large 14 millimeters tooth from the man's nose, and it is strange that the tooth had grown properly. But of course your nose is not the place for that. Doctors were able to extract the tooth from the nose, but they left behind a 2-centimeter hole in the nasal septum as well. The man had been in pain for months, if not years, and had no idea what was behind all this. His nose contained a strange substance, not in his wildest dreams. Did he think about a tooth stuck in his nose? According to many reports, it is common to find irregular, crooked tooth growth and even pain due to such patterns, but teeth growing upside down have never been seen before, even though the growth causes pain, numbness, and even bleeding. This man had none of these effects, and was even having breathing problems, due to his teeth blocking the nasal passage. 3 months after the operation, the man is in good health and the pain and even breathing difficulties have disappeared permanently. And with that, the strange case of the tooth in the nose is over. Click on one of these 2 videos on the screen now.